So you made it here because you have a thyroid issue, right? Now, would it be interesting for you to know that 9 out of 10 people who are diagnosed with a thyroid problem actually don't have a thyroid problem? You have an autoimmune disease or an immune system problem, which is attacking the thyroid. So right off the bat, if you have the wrong diagnosis, you can't get the right treatment program, right? And some of you have been battling this issue for years. You go to your doctor, basically your doctor checks your TSH, and that is just either a refill of your current dosage of your medication, an increase or a decrease of the dosage of your medication, right? The problem is that is treating the smoke versus treating the fire. What do I mean by that? I mean, where there's smoke, there's what? Fire. But if you have a fire in your house, you don't look to see where the smoke is, you look to see where the fire is. And so if all you're doing in your current treatment plan is chasing symptoms, right? And what do I mean by symptoms? Fatigue, inability to lose weight, bloating, diarrhea, constipation, anxiety, depression, things of that nature, right? These are common thyroid symptoms, but just because you have common thyroid symptoms doesn't mean you actually have a thyroid issue. Or you might have a thyroid issue, but you might have other issues that are not being checked. So and when they do find issues, what happens is you're treating the smoke and not the fire. And so what I'm here to tell you is I'm not here to give you a better option of what you're already doing. You don't need a better mousetrap. You need to treat the fire and not treat the smoke. Now, this video is for people who have already been doing research. You're in your Facebook groups. You're listening to podcasts. You're watching YouTube videos. You're watching webinars. You've already done that stuff, but for whatever reason, you haven't taken action, or you took action, but you just didn't, you didn't move forward with the options. I'm not sure, who knows what happened. So the reason I'm actually doing this video is we do a webinar as well on thyroid issues. And a lot of people have been telling us, listen, I'm tired of signing up for a webinar that's in 5 days. They forget about it. They join late, right? They're ready to actually take action. And so this is based on recommendations of our current patients who are like, just offer people the ability to get started. So if you're interested in learning what it means to treat the fire and not the smoke, to get to the bottom of the issue, then if you click below, we'll have the opportunity to have a discussion. I mean, I can't talk about anything but general things in a video right now anyway. We can now talk about specific things about you, about what you've done in the past, about what has worked, about what hasn't worked, about what you're frustrated with, about what you've been diagnosed with, about your family history, etc. So we can get to the bottom of the situation and treat the fire and not the smoke. You'll also have the ability, when you click to schedule underneath, to sign up also for a toxicity test. Listen, I know you have toxins in your system. What I don't know is how many toxins do you have? And which toxins do you have? Why is that important? Well, because toxins block entryway into the cells. Well, what needs to get into the cells? Hormones. So thyroid hormone or any other hormone you might have trouble getting into the cell. But different toxins affect different cells of different organs. So doesn't it make sense that we would want to know which toxins so we know which organs are the ones we need to address? If that does make sense to you, then you might benefit from us having a one-on-one conversation. We call it a special assessment call, where we can figure out what you've done in the past, what smoke you've been treating, what fire you need to be treating, and figure out your next step. On this call, we're not going to solve your entire case, but what we are going to do is figure out what is the next best step for you. Okay, that's what the goal of this call is for. It's a Zoom call. What is the next best step for you? Now, in terms of diagnostic testing, you might need adrenal testing. You might need gut testing. You might need food sensitivity testing. For sure, I don't want to say for sure, 99% of the time, you're going to need a toxicity test so we can figure out, again, how many toxins you have and which toxins you have. So you have the ability to also order that below if you want to. Again, this is for people who have already been doing their research. If you were just diagnosed, last week, setting up the call, while we can do it, might not be the best thing for you. You might be better doing a little bit of research. And if you want to watch our webinar, just get in touch with us and we'll send you a link so you can register so you can hear a little bit more. This particular option is for people, you've already been doing that and you're just like, I don't want to sit through another webinar. I don't want to watch another YouTube video. I don't want to listen to another podcast. I just want to get started, right? I want to take action. And so if you're ready, click that button. You'll be scheduled. We'll have that conversation. We'll have specific information where you and we can have a conversation and we can figure out if it's a good fit to go forward with that next best step. Either way, I wish you nothing but luck. Click that button below and I hope to see you in the very near future.